I remember going on a hike one summer and realizing halfway through that I'd forgotten my water bottle. The sun was beating down, and every step felt heavier. I came across a stream, but the water was cloudy, and I knew it wasn't safe to drink. I kept searching, thirsty and exhausted, but there was still no clean water source. That feeling of desperation stuck with me, knowing I needed water, but having no safe option. It made me think about what it must be like for people who go through this reality every day.
Hello, my name is Aryan Patel, and I am an HBCSC Environmental Health Ambassador. Today, I will be talking about a Flint Water Crisis, a call for environmental justice and health equity. Imagine waking up one morning, going to your kitchen, and turning on the faucet, only to watch brown water pour out. Water contaminated with lead. Now imagine this happening day after day in your community, affecting your family and your children. Imagine the water that should be nourishing you is now silently poisoning you. For the people of Flint, Michigan, this wasn't a bad dream. It was their reality. Flint is a predominantly African American community, and for years, its residents were exposed to lead-contaminated water. The impact was devastating. Lead exposure doesn't just disappear, it causes permanent damage, especially in children. According to studies by the Centers for Disease Control and Prevention and the World Health Organization, lead exposure in children can lead to developmental delays, learning disabilities, and long-term health issues like hypertension and kidney disease. These aren't just statistics. These are real people, real families whose lives and futures were forever changed by the crisis of Flint, Michigan. But here's the thing. This wasn't just an infrastructure failure. This was a failure of justice. The residents of Flint didn't just suffer from contaminated water. They suffered from environmental racism. They were treated as though their health and their lives mattered less. And it wasn't until grassroots movements, protests, and national outrage brought attention to Flint that the world began to listen. But the damage had already been done. The intersection of environmental injustice and health equity is starkly visible in Flint. Lead contamination alone is catastrophic, but in a community already burdened by poor air quality and limited access to healthcare, it amplifies an already dire situation. African American children, who were already more likely to suffer from conditions like asthma due to environmental and socioeconomic factors, now faced a future filled with lifelong health challenges exacerbated by lead exposure. According to a study by the Centers for Disease Control and Prevention, African American children are almost twice as likely to be hospitalized for asthma compared to white children, largely due to their disproportionate exposure to environmental hazards like polluted air and subpar living conditions. The additional impact of lead contamination in Flint not only compounded these pre-existing vulnerabilities, but also increased the risk of developmental issues, cognitive impairments, and chronic health conditions that would affect them for the rest of their lives. This underscores the deep connection between environmental injustice and health inequity, where neglected communities like Flint continue to suffer the brunt of system failures. And that's where the urgency lies. Flint is not an isolated incident. This is a wake-up call for all of us. Environmental hazards, whether it's pollution, toxic waste, or contaminated water, don't affect everybody equally. It's the communities of color, the low-income neighborhoods, and the disadvantaged populations that bear the brunt of these dangers. They are already vulnerable, and these hazards push them further into the margins, exacerbating health disparities that have existed for generations. But here's where the hope lies. We have the power to change this. We can't undo what happened in Flint, but we can ensure it never happens again. Policy interventions, stronger regulations on industrial pollution, toxic waste disposal, and water safety can prevent this. But it doesn't stop at policy. Real change happens when we engage the communities affected, we listen to their voices, and allow them to lead the change in shaping the future. Flint was a tragedy, but it doesn't have to be repeated. Together, we can advocate for a more just and equitable world, where no one's health is compromised simply because of where they live or the color of their skin. We owe it to the people and children of Flint, and to every child in every underrepresented community, to fight for environmental justice, to fight for health equity, to fight for a future where clean air and water aren't privileges, they're rights for everybody. Thank you.